Hi there, today we're going to talk about sacroiliac joints. So your sacroiliac joints are at the base of the spine towards your pelvis, and there's a triangular bone at the bottom of the pelvis which your lower back comes into, and at the other end is your tailbone. Now that area can be a real problem for people, and once you've aggravated the sacroiliac joints, you know you've done it. Chances are if you've irritated one side, then both sides may feel slightly aggravated, and it's really key to sort of find out which side is the problem, because as it's going across the lower back, you may feel that it's the lower back that's the issue rather than the sacroiliac joints, and you may be applying the wrong exercises. So this one, as I've said before, I really like things that you can use to help figure out where the problem is and also use it as a fix. So we're going to go through a short exercise for sacroiliac joint. So we're lying on our backs, and if you keep the right leg bent with the foot flat and send the left leg straight out. So the side we're working and the side we're trying to evaluate is our right side. So arms just down, and if you push with the sole of your foot into the floor, we want to keep the knee pointing up to the ceiling. You're going to tilt your pelvis. Now if I put my fingertips at my hip bones, you can hopefully see when I start to roll that I'm lifting my right hip up and I'm coming back down to the mat. So I want that knee to stay up to the ceiling and not follow the hips as it goes across. So you should feel a big opening at the front of the hip and then a closing as you come back. Now, the key with this is once you get into the lift and the lower, is to go slowly. So maybe breathe in as you lift and breathe out as you lower. So you're getting the benefit of working on your breathing at the same time. And all of this is trying to tell us where the problem is and also give the joint the experience of opening and closing. And so if we look at the opposites in the body, so if we're opening at the front of our hip, we're closing that sacroiliac joint. And as we come back down, we're opening the sacroiliac joint and closing the front of the hip. And so it starts to give you some clues. So if I have discomfort when I'm in this position, my sacroiliac joint is closing. And so then I'm going to want to emphasize the opening so that I get it feeling a little bit easier with that movement. Now always moderate your movement to make sure that it's comfortable for you. So breathe in as you lift and breathe out as you lower. Try not to squeeze the bottom. Now you're naturally going to find the glutes tighten up a little bit when you lift, but we don't want to add to that. And so if we've gone through sort of 6 or 8, maybe up to about 10 of them, you don't want to overdo it, but you want to do enough to get some movement there. It's always useful to try the other side. And so again, I'll just put my fingertips at the hips so that when you see the lift, you can see that I'm lifting my left side now, and then coming back down. Now this right leg is staying heavy against the floor and my left knee is staying up to the ceiling. And so we're opening at the front, closing at the back, closing at the front, opening at the back. And again, just trying to use this to figure out what part of the movement does my body not like doing, my sacroiliac joints. And then you're going to use the opposite movement and just emphasize it. And so ideally we want to do this a couple times a day. All of our joints in our body need to open and close, and so we're just allowing it the opportunity to do that in a controlled environment. So try this one out, let me know what you think. Hit like, hit subscribe. I'm Brule-Walker, your movement mentor.